Okay, welcome back to the Cancer-Free Reality Show. My name's David D. I'm your host of this video series, and just wanted to let you know what's going on in my life. 41 years old. I just found out that I have testicular cancer. Found out over the summer. And how I found out was that one of my testicles was enlarged on the left side, and the cause of it was because I had a non-descending testicle since birth. And, you know, the pediatric doctor knew about it, but he said eventually in time that it would drop and, you know, as you progress and get older. Well, as I got older, it was like halfway in, halfway out. Not all the way into the scrotum, and so all of a sudden, you know, after 20-something years without ever seeing a doctor, I'm having to go see a family doctor, and I asked him about the the incident. I asked him about hydrocele, and what hydrocele is a fluid that builds up around the testicle, and sometimes that's a form of the enlarged testy, that it could be fluid around the testicle. And so I asked him, I said, well, what do you know about hydrocele? And he says, well, I understand, it's the fluid around the testicle. And he said, well, do you think something's going on down there? I said, well, I don't know, man. My testicle blew up, within the last few weeks, and so, I'm wondering what the heck. I'm thinking that it's all happy because it's free. It's out from being hung up, but that didn't seem to be the case. So, he took a look at it. He said, yeah, you need to do an ultrasound. Right away, like ASAP. So just in case, it's not testicular cancer or anything like that. So I went from, my family doctor, and he set up an ultrasound for me at a different ultrasound imaging clinic. So that was interesting. And so I get there at the ultrasound place, and it's wide open. The lobby is barely anybody there. It's got this big, huge building, and it looked like they weren't even busy at all. So I get in there. I have to fill out more paperwork. I mean, there has to be about 7 pages to find out how are you going to pay for the visit. So I mean, you could spend at least a half hour just filling out paperwork. Half of it is about your previous medical conditions, and then the other half is how you're going to pay for it. So anyway, got that all filled out, and then I got called back into the ultrasound room. It was interesting, many of you who've been into ultrasound places, it's kind of dark because they need the imaging computers and the monitors to see exactly what's going on. And so, I had a good-looking nurse, which was good, but embarrassing at the same time when she tells me, okay, you need to, take your shorts off, take your underpants off, and lie down here on the table. And I'm like, okay, this is all new to me. Again, I haven't seen the doctor in about 20 years. So I'll go ahead and I do that, and lay on the table, exposed, and I'm like thinking to myself, what am I doing? What's the deal? Why am I here? So all of a sudden, I'm laying there, and she says, okay, there's nothing to be embarrassed about. We see this all the time. I say, yeah, for you, but for me, this is my first time, right? And so So I'm laying there, and then she pours on this KY jelly on my, on my genitalia area there, and that was interesting. And then she takes this wand that kind of looks like a scanner at the grocery store, and she starts rubbing the area and things like that. And lo and behold, I'm embarrassed, and it's like, yeah. So, where did you go to school? How long you been doing this? You're trying to carry on small talk. It's just not working, And so, after a couple questions, I just, shut up, and I just let her do her work and stuff like that. It was pretty interesting, though. They were able to hook up the sound monitor to it, so I can hear the blood flow going in and out, and that was special. That was interesting. And I didn't get to see. Well, I got to see a little bit on the monitors and things like that. So anyway, make a long story short, I was embarrassed. It was my first time, and then got up and got dressed and say, yeah, thanks a lot. Hopefully I don't have to do this again. So a few days later, here I am. I'm working, and I get the phone call. Yeah, we got your lab test back, and we need to see you right away. So it's the call that you never want to get. I had it was almost like a 50-50 chance, If I figured if the results were negative, they would say everything's good, everything's negative, so you're good to go. Well, that wasn't the case. We need to discuss the results, and you need to come in. So I said, okay, and it kind of stops you in your tracks. You're wondering, you're scratching your head and stuff like that. And so I left work early, and I went up there and talked to the doctor, and he sits me down, and he says, tries to be polite. Thanks for coming in on short notice, blah, blah, blah. And he says, well, I'll tell you what they found. They found a mass in your left testicle, and that you need to, I'm going to have to assign you to a urologist that specializes in these matters. And, I've taken it as far as I can take it, but you need to go see the urologist. And then, so I said, okay, yeah, and he went over, he bent over backwards to get me an appointment right away, which was good. So the whole process, I've had good doctors, I've had great doctors, great nurses, and that's good because, they got a good bedside manner, if you will. Even if they're faking it, I mean, it's they've been good. So as far as, wanting, interested in me and the patient and so forth. So that part's been good. So I go see the urologist, and, I'm running out of time. I don't know how much time I have. Yeah, I'm way out of time, but I'll let you know in this next video segment what the urologist said and what we did from there. So stay tuned.